MLK Community Hospital in Willowbrook offers vital health care for underserved areas of Los Angeles. And now, because of federal funding cuts, the hospital is facing a crisis.
Will it be able to keep its doors open? Eyewitness News political reporter Josh Haskell has the 7 on Your Side investigation.
If that hospital shuts down, people will die.
3 years since the COVID pandemic ended, Martin Luther King Jr. Community Hospital in Willowbrook is still receiving and treating patients in tents outside where ambulances used to park. Their emergency room is one of the busiest in the country, even though they're a small community hospital, because they serve an area with few clinics and hospitals. 80% of their patients are covered by Medicaid. And now, staggering cuts to Medicaid, part of the big, beautiful bill, which will begin at the end of this year, $1 trillion over 10 years, would leave the hospital with a 20% gap in revenue.
We're worried about our patients losing their coverage, which means that they won't be able to access care outside of the hospital. They'll wait until they're sicker, and they'll end up coming into the hospital needing more care.
When the Medicaid cuts take effect early next year, MLK Community Healthcare will lose an estimated $80 to $100 million per year. MLK hospital officials say that's unsustainable and they could eventually be forced to shut down. It wouldn't be the first time. The 131-bed hospital closed back in 2007 after becoming ineligible for federal reimbursement for Medicaid and Medicare patients over quality of care issues. The hospital reopened in 2015 with a new $208 million building, thanks to a public-private partnership involving the state, county, and UC system.
We're doing everything we can to keep the hospital open. This community knows what closure looks like. There was no hospital here for 8 years already. It left a gaping hole in South Los Angeles. People who had gunshot wounds were more likely to die.
People like Marcus Liddell, who's disabled because of a workplace injury. But that's not what landed him in MLK for 22 days last February.
I had caught pneumonia, and they thought it was another infection in my lung, a staph infection. And Dr. K and the lung doctor, they revived me. I thought I was over.
Liddell says receiving treatment near where he lives was key to surviving his infection.
I couldn't have probably made it nowhere. I couldn't even breathe.
Dana Rogers' father, Willie Pollard, spent 7 months at MLK for a gallbladder infection.
He was so swollen and infected really bad, and I didn't think he was going to make it. So they were able to go in and get all the gallbladder out. And the hospital worked with us so well. You know, I was so overwhelmed and afraid. I thought my father was going to leave, you know what I mean?
Dr. Maida Kuvengua, or Dr. K, treated Marcus Liddell and Willie Pollard.
These are human beings at the core of it all. In Dana's dad's case, he's retired. He's 74 years old. He can't work even if he wanted to. This community has been marginalized and neglected for decades, and we really need to right that wrong.
So what's being done to save MLK Hospital? Measure ER was passed by LA County voters in June, and there's also the billionaire tax on the ballot this November. But hospital officials fear the money generated by those measures may not be enough.
The county doesn't have the money. The state doesn't have the money. The money comes from the federal government, and they're paid through Medicaid and Medicare, which the federal government controls. And they've cut that. The president has cut that tremendously.
Hospital leaders say they will be watching the midterm elections closely and hold out hope the federal government reverses the cuts.
I think that healthcare is a bipartisan issue. I think that what people don't think about is that if a hospital here closes, those patients are going to go somewhere else eventually.
In Willowbrook, Josh Haskell, ABC 7 Eyewitness News.
Our investigative team is always looking for your input. Send your story ideas to abc7.com/7 on your side.